So firstly, I would like us to usher the Provost of the College of Medicine, University of Lagos, Professor David Oke, ably represented by the Deputy Provost, Professor David Oke. Let's see the round of applause at the podium. I would also welcome the Dean Faculty of Clinical Sciences, Professor Olashade Akishola Kibayaki. Please let's welcome her. Welcome, Professor. Let us also welcome the Chairman, Lagos Chapter Untitled Alumni, Dr. Olu Benjamin. Welcome, sir. Welcome, sir. Welcome sir. Let's also welcome the head of the Department of Radiation Biology, Radiotherapy, and Radiodiagnosis, Dr. Adekunle Ayokunle Adeomoye. Welcome, sir. We will also be welcoming the convener of this event, Dr. Omoyinla Salako, lecturer from the Department of Radiation Biology, Radiotherapy, and Radiodiagnosis. Wonderful to have you. We are proud of you. So with that, I'll be handing over to the chairman, Lagos Chapter Alumni, to lead us in the opening prayer so that we can officially open this program. Thank you very much, sir.
Our dear Father, I want to give you praise and thanks for this beautiful day, for the start of this great mission that my friend and sister have envisioned for a while. Thank you for taking the again to our mind and bringing it to fulfillment. Today we give you praise and glory in the name of Jesus. For that, I will start this program for you to take absolute control and to your name will be glorified. Help us, give us good glory, give us good praise, that our names will be written in the hand of God for good works. Nation is blessed and beyond. Jehovah will pray. Amen.
Thank you very much, sir. The round of applause. Next, we are going to be taking the second stanza of the national anthem. So please let's be on our feet. All right, the first stanza of the national anthem. The first stanza. Department of Radiotherapy, Dr. Habibu, to the high table, please. Let us show him with a round of applause. Okay, so to open this event, before we go, let me just talk briefly or make a brief statement. In the past decade, we've seen the increased relevance of digital technology in healthcare. We've seen it in the form of telemedicine, we've seen it in the form of rising technologies that have been adopted in different healthcare spaces. Mobile healthcare, as well as other innovations that have become increasingly relevant. And today we are going to be taking a deep dive into these concepts, as well as launching the departmental digital health hub. So, moving forward, I would welcome the head of the department, radiation biology, radiotherapy, and radiodiagnosis, to give us the welcome address in the person of Dr. Adekunle Ayokunle Adeomi.
Of your clinical sciences and chairperson, Lagos State alumni, UNILAG alumni, the head of radiotherapy, and all invited guests. We are all welcome this morning to the launch of the digital health of the department. Feel of joy that this is taking place at this time because the department has recorded so many firsts. The department was inaugurated at the inception of the university, and because of the need to take care of cancer patients, the first radiotherapy machine in the country was unified in this department. And today again, we are inaugurating the digital hub, which will be the first of its kind in any department of the country. I know that in a resource-poor economy like our own, having manpower to reach out to the populace is a challenge. And so this will be a major important milestone that will bridge that gap. It will also aid in a lot of researches that we can make and grants that can be brought into the university community. Once again, I welcome every one of us. Dr. Salako will be giving us a little brief on this, and then we have a few more speakers who will be speaking with us through the Zoom that we projected online. This ceremony is not expected to take more than 1 hour, so we pray that you just bear with us and we'll soon. Once again, I welcome every one of us. Thank you very much.
Thank you very much, sir, for that welcome address. So I've been reminded by our distinguished guests that I have not introduced myself. My name is Bola Wate, and I am the moderator for this event. I'm also the Vice President of the Association of Medical Students, but for today, I am the moderator. I would like us to recognize the presence of a few distinguished members of the audience as well. Dr. Ibu Okiri, the Deputy Director of Biomedical Communications, Mr. Uwe, the Deputy College Secretary, the round of applause for him, and Dr. E.G. Akindele of the Department of Pharmacology, Therapeutics, and Toxicology. The round of applause for our distinguished guests. Next on our agenda, we will be having the opening remarks by our chief host, the Provost College of Medicine, University of Lagos, represented by the Deputy Provost, Professor Ibrahim. Good morning, everybody. Good morning. The Dean, Faculty of Clinical Sciences, College of Medicine, University of Lagos, University of Boston and nationwide, the most preferred university like the acting head of the Department of Radiation Biology, Radiotherapy, and Radiation Diagnosis. Associate Professor the head of the Department of Radiology, Lagos University Teaching Hospital, Dr. Abi. Our able, amiable, and dynamic chairman, University of Lagos, alumni, Lagos State Chapter, our able man. And then our lecturer of the moment,
the one who really has brought us all here with a big smile, the one who is really making wave in the area of research and our very special Dr. Malola Salako. Let me bring greetings from Provost College of Medicine, Professor David Adewale Antonio, who really would have been loved to be here physically today, but for another very emergency meeting, he has asked me to stand in for him and also give this opening remarks. I want to also highly commend the lecturer of the day, who really has brought this down to the department, and we are all celebrating today. I'm glad that I've come to know him as one of my very brilliant students, because I taught about chemistry way back 1999 in this college. So well, fantastically well. In our chosen career, and today we are seated together at this high table to make this, to celebrate this wonderful innovation in the College of Medicine branch of Lagos. It gives me a great pleasure to present this speech on behalf of the Provost College of Medicine, University of Lagos, Professor David Adewale, who could not make it here today due to a last-minute emergency. It is a delight to have you all with us at this special launch of the Departmental Digital Health Hub. A special thanks to those who have also joined us virtually and all those who are physically present here. I would like to express my appreciation to our amiable and dynamic Vice Chancellor, Professor Oluwatoyin FPS, for his support and for his innovation drive for the University of Lagos, who will also be joining us very soon in the commissioning of this digital hub. I'm excited this is happening now, especially when the COVID-19 pandemic has restructured the way we access healthcare system. There is a proliferation of digital health initiatives, products, research globally, and we are excited that some of our academic staff are active in this revolution. A few weeks ago, we launched the Telemedicine Center in Biomedical Engineering, and Dr. Solomon Wanliri from the same department published a book titled Information and Communication Technology in Healthcare. Today, we are gathered to support the innovative work of Dr. Omulola Salako, a lecturer in the Department of Radiation Biology, Radiotherapy, and Radiodiagnosis. Recently, she attracted 3 healthcare innovation grants from Lagos State Science and Research Innovation Council, Conquer Cancer Foundation, American Society of Clinical Oncology, and Oncopadi Technologies. Based on her grantmanship, the Departmental Health Hub, also known as the RDRR Hub, has been set up to accelerate mobile health research, innovation, collaborative, co-creation, and launch health tech startups within the academic community. This is in line with the vision of the Vice Chancellor of the University of Lagos, Professor Oluwatoyin FPS, to launch 5,000 academic entrepreneurs by 2025. The College of Medicine, University of Lagos, is positioned to produce at least 30% of this target. The College of Medicine, University of Lagos is at the forefront of pioneering digital health technology. We are positioning ourselves to provide digital health solutions that will improve the quality of health care generally. Healthcare innovators and digital health can help make
health system more efficient and sustainable, enabling them to drive good quality, affordable, and equitable care. Digital health offers unique opportunities to improve the quality and efficiency of research, in part through high-quality data collection, researching outside of the healthcare facility or clinic, such as in the study, participant home, or workplace. I want to specially congratulate our Professor Olashade Akinshola, the Dean of the Faculty of Clinical Sciences, the largest part of the University of Lagos. Professor A.A.O. Ademoyi, the acting head, Department of Radiation Biology, Radiotherapy, and Radiodiagnosis. Dr. Mulola Salako, the chairperson, Departmental Digital Head Corps, and all the academic staff of this Department of Radiation Biology, Radiodiagnosis, and Radiotherapy, and the entire college community, and by extension, University of Lagos, for pioneering this laudable project. I sincerely appreciate the Oncopady Technology Limited for the enormous resources on this project. I'm very sure that there will be a remarkable improvement in our healthcare system delivery. Let us all take this opportunity as an opportunity to learn from this innovation and make the best use of these resources. Additionally, let us be active in using the digital platform for our research and for other healthcare service delivery. You never know, you may just produce the next health tech unicorn. Thank you all, and congratulations.
Thank you very much, sir. That was Professor Lee, the distinguished Deputy Provost of the College of Medicine, University of Lagos. Thank you very much for that. Lovely remarks, sir. And we also appreciate our Provost, Professor David, who is not unavoidably absent. Thank you very much. I would like us to recognize the presence of, as well as usher to the right table, Professor Abayomi Okorawa, who was the former Deputy Provost of the College of Medicine, University of Lagos. Please, can we join the right table? Thank you, sir. We will also be welcoming Dr. Mrs. Ipaye, who is the former registrar of the University of Lagos. Please, a round of applause, please. Thank you very much. It is great to have you with us. So, coming up next, to talk about the RDR Digital Health Hub, which is being launched today, I would like to call our distinguished lecturer of the day, Dr. Omolasa. Please, a round of applause as she comes up.
Good morning, distinguished participants, distinguished high table, starting with the provost, ably represented by the deputy provost. Thank you, sir. To my mother, my grandma, the dean of Faculty of Clinical Sciences, Professor Akinshola. Thank you, ma'am. To the HOD, Professor Okanabo, thank you very much, sir. God bless you. Chairman of our alumni Lagos chapter, thank you. I honor you, and thank you for the many things you are going to do for my department. To my HOD, Dr. Ademoye, and the HOD of Radiotherapy, thank you very much. I'd like to also say thank you to Dr. Ipaye from the Atom for Digital Research Center in Unilag, and to Dr. Showme for being present, and to everyone here, thank you for your support. So, very quickly, I'm going to talk about the Digital Health Hub and how it started. The truth is, every time I'm in this premises, and I've been here for the better part of my life, almost half of my life, I came in as a medical student. I wasn't the A-star medical student, but I wasn't also the worst medical student. I was always in between. And today I'm surrounded by my teachers, and I just know that life comes in seasons, and then to have them scold me and then to support me, I'm really grateful. The College of Medicine, University of Lagos is one of the most brilliant medical institutions in the world. And we stand out wherever we go, whether we're in Nigeria or we're abroad, we truly stand out. And I just want to say that the Digital Health Hub is good morning, ma'am. We would like to welcome Professor Olushaki, the Dean of Academic Planning, Director of Academic Planning. She is representing the Vice Chancellor, Professor T.A. So the Digital Health Hub is also known as the RBRR Hub. And the reason why we set this up is because the brain power we have in the College of Medicine must be harnessed to digital health. If you look at the data of 2020, Nigeria startups raised about $500 million. The health sector in that amount raised about 120 million. And the academic community was minutely represented. Yet, we have the most intelligent people in this community. So for us, we believe that if there's an opportunity out there and we have the brain power in here, we must bring them together to raise the glory of our institution. There are 4 revolutions, and we are currently in the 4th revolution, which is the technology revolution. As a medical training institution, we must position ourselves there. We must create an enabling space. One thing I know is that medical students especially have digital health ideas, but they don't have that enabling space, that enabling community to transform that idea into a startup. A startup is a young organization that produces a valuable product that is profitable. And if you look at the common antibiotics, it was started with an idea, it was marketed, it was researched, and it was sold, and it has become profitable. How many startups do we have from our college that we can point to that is profitable? And the reason why we don't have so much of that is because these ideas are not, students are focused on academics, which is very important. But if you compare them to their colleagues abroad, as much as students abroad are focusing on academics, they are also building successful companies. And so for us, we are a new generation in the college. We are the millennial generation. People born in the 1980s are called millennials. We are very adept with technology. We love it. We like it. We were born with technology. But for my own set, we got exposed to technology when we were in our 18s, 20s. Unlike the alpha generation who are born into technology and are using telephones right from age 9 months. So you will understand that certain generation come with certain advantages and certain disadvantages. For the current medical student population, they are alpha, they are generation alpha, generation, what's your generation VP? Z, generation Z. The way they behave as medical students is different from the way I behave, and it's different from the way our baby boomer generations behaved. So for us, setting up a hub that brings in the ideas of the students and academic staff was very important. Because 5 years ago, when I started, I came up with this idea, I didn't find the support I needed around me. I had to go outside to get support. Then I have come back in with the support of my co-founder, Dr. Adara Modu, an alumni of this great institution, and the first female AMSO president. something out. People like, of course, Dr. Adara said, most of them are abroad. But one of the things that has made Dr. Adara early to stay is because she has found something purposeful in the space of digital health. And we will not be here today if not for the support Dr. Adara has also given me in running the digital health space. So today I may be the one holding the mic, but I have a capable team, and I'd just like you guys to quickly stand up. Dr. Samuel Ekundayo, who is our Digital Health Research Fellow. He's with us for 6 months and will renew for another 6 months. He's in charge, he's a postdoc, he's in charge of the mobile health research. So I have a capable head to think with. I'm not powering it in. Our clinical research nurse with double degrees, registered nurse, public health. She's the clinical research nurse supporting us in our duties. Mr. Henry, who heads our business development unit, because every startup is a business. We are not here to do charity. I also run a charity, but this is not charity. It has to be sustainable. So for every idea we have, we want a situation where someone like Mr. Henry will come in and say, how can we make profits? Because we are going to spend money to bring this idea to life. How do the investors get their money back? Agnes, who is a statistician and an AI specialist in the making, has been working with me on our different research projects, and she's also a project manager. And I must thank Mrs. Otutu, our departmental secretary, who helps in coordinating so many things every day. Please stand up, you're part of the team. Thank you. And so we'll go over to the hub in a few minutes. It's basically a small space, but in that space, we bring ideas to life. So we're not focusing on equipment, we're not focusing on things. Come with your idea, we'll sit with you and bring that idea to life. The way we have brought about 3 digital health ideas to life. The way we have found grants to bring those ideas to life. That's what we will do at that hub. With a team, an internal team that is research-based, business-based, we will bring that person with the idea and connect them with the right people they need. We will also get support from Innovation Center in Unilag, from Atom Banepo in Unilag, and from the industry. Next slide, please. Now, this is one part of the hub, and this is where the mobile research team sits. It's an office for 4 people. It can accommodate about 6 people. But right now, there are 4 people. So every time we have a research project, we have a mobile health research team that is properly trained to write the manuscripts, the proposals, get ethics approval, and so on and so forth. At the moment, we are working on 2 mobile health research projects. One is the PROS, where we're developing an app where cancer patients can report their side effects from home. And we're developing another platform that allows oncologists like my colleague here, Dr. Alabi, to consult with cancer patients in Olabisi Onabanjo University Teaching Hospital, where they don't have oncologists. And that program is called ARC, A-R-C, Accelerating Access to Remote Cancer Care. Next slide, please. Sorry, please go back. The mission of our hub is to accelerate mobile health research. Our goal, by this time next year, we should have published about 6 mobile health research papers. We want to contribute to knowledge. We must contribute to knowledge. And when they're looking for the most reliable data on mobile health research, they'll be coming towards our department and towards the hub. Secondly, we're promoting innovation. And this is the place where we're going to partner with other clinicians from different departments on how can we digitize their records? How can we improve waiting time? How can we use artificial intelligence to read X-rays? And we have so many attributes in the college. Dr. Omaneri published a book recently on ICT, and it was the first, I just came across the book 2 weeks ago. I've started to read it, and it's wonderful. So if you're interested in digital health, I think that is a book we must all read. We also connect startups. So we're producing papers, we are developing ideas, but we must develop startups, we must develop companies. Right now, I'm talking to some of my colleagues like Dr. Irube And we're thinking around what ideas can we what ideas can we bring to life to make the mobile health research activity much more. So please, if you have any ideas, come to us. We will sit down, with you, spend an hour or so and flesh that idea into reality. Next slide. So our objectives are to be a vibrant academic contributor in the digital health space. We are positioning the department to be a leader in mobile health research with global collaborations and to launch and sustain successful health tech startups. I must mention that in UNILAG, the Vice Chancellor has an ambitious goal of producing 5,000 academic entrepreneurs. And for us in the college, we should identify our percentage. Are we taking 20% of that 5,000 or 30% of that 5,000? For us at the hub, we want to identify, at least, we want to contribute 10,000 academic contributors from our over there, 400 level medical students. She's my mentee and she's been interning at the hub. Just 2 weeks ago, they concluded the BITES program, Business Intelligence. I can't remember what the T is.
Business Innovation and Talent Expression.
Thank you. Business Innovation, Talent Expression. And there are about 1,000 applications. She turned out to be top 30. And she represented our college very well. But I was a judge in that program, but we had less than 20 medical students perform. So people like Toby are the bridge between UNILAG, great programs, and the medical community. And this hub belongs to you. I keep telling you, it's not for me. I've achieved what I want to achieve in digital health. This place is a place for future generations. So we have created a small room today. It's you guys, BP. It's you guys that will build the big building that will stand on its own like the Atom Banefo Digital Research Center. Yeah. And we will have labs for pharmacy, pharmacognosy, and the likes. So some of the things we do we create innovative solutions, and right now we're in the process of creating a platform that will allow cancer patients to report their side effects. And to that end, we've attracted some international and local grants. That's why we're able to do this. We're not just building the app for our ideas. We have conducted 3 focus group discussions with these patients, asking them, if we build an app like this, take a look at it, do you like it? What do you want this app to do? So we have to understand from the patient's perspective, and it's a mixed model approach. And when we finish with our research, then we go and sit with the tech team and say, build our app like this with the patient's voice and with the physician's voice. So we've attracted 3 grants, and we're grateful for it. We have role models in this institution, like we want to be like Professor Afolabi, ONG. We want to be like Professor Ogoshola. We want to be like Professor Akishola, and so many more. We want to attract $2 million, $10 million grants because it is out there. Collaboration. So I'm appealing that with digital health, if we look at the successful model outside, it is built on collaboration. UNILAG is also very sensitive and very, very effective when it comes to intellectual property. So I'm very glad that my department is also positioning itself as the department that has the highest number of patents. Dr. Ebitoye has registered the patent. Thank you for setting the example in the department, and I'm following him. I'm registering my patent with UNILAG also. And so the idea is we will build successful businesses that are registered and recognized by UNILAG, and UNILAG, being a global brand, will lift up our startup to that unicorn status. A unicorn startup means your company has been valued at $1 billion. We already have 3 fintech companies that are valued at $1 billion in Nigeria. One of them is Flutterwave. And there's another company that will hit that status by next year. We need to bring that good luck, hard work into our academic community, and that is what this hub is targeting ideas that become successful companies that solves problems. Next slide. And so this is just a small section of our research team. Kene on the left, the first tall guy on the left is a 400 level medical student from University of Ibadan. He's a fantastic guy. He worked very closely with me to develop one of our research proposals. So we are working with students beyond College of Medicine. We are looking for people who are interested in digital health. We are not trying to force people or pay them to work with us. We want people who are committed to the work. And that's Dr. Adejimi. Okay, that's Amaka, the second lady, our clinical research nurse. The third lady was the scriber when we did our focus group discussion from Community Health Department. That's Dr. Adejimi, a lecturer at Community Health. Agnes Toby. That is Dr. Bukola. She's from the Entrepreneurship Skills Development Center of Unilag. She's an Aruba scholar. That's myself and Dr. Ekundayo. Next slide. And so I've talked about who we are. We're a community of healthcare innovators providing knowledge, process, and resources to support the next generation of healthcare innovators through the hub. We're domiciled in the Department of Radiation Biology, Radiotherapy, and Radiodiagnosis, College of Medicine. And we have spent about 5 million naira renovating the hub. And I want to thank Onkopadi Technologies Limited for permitting us to renovate the hub, because when we had our internal meetings, initially we thought it wasn't a good idea. Why invest? Why spend 5 million renovating a place? But I want to thank the board of Onkopadi for allowing us to use some of the grants, one, to renovate the hub. Next slide. We have an acronym called REACH. We are conducting quality mobile health research. And we do this through research ideation, ethical conduct of research, and we are applying for grants that will power our research proposals. We are innovating, we are solving common day problems faced by patients. And through our solutions, we are going to through our research findings, we're going to create viable solutions that are patentable. We don't want to come up with ideas that are not patentable or profitable. And we're going to do this through collaborations with various partners. And finally, we want to launch sustainable startups, young organizations that are profitable. Next slide. Our 2021 goal, we've hit it by launching the RBRR Digital Health Hub. By next year, we hope to publish 4 mobile health articles. We're being very conservative with this target and attract at least $1 million in grants. We want to create innovative solutions that solve 3 healthcare barriers. One of the areas we're specializing in is cancer. I'm an oncologist. We also want to create 4 solutions to solve these healthcare problems. And finally, we want to launch 3 health tech startups that will have viable solutions that will be recognized by the college and as well Unilag. Next slide. Some of the things we've done in the past. Last year, just before the pandemic, we organized our first masterclass right here in this building. And we attracted about 40 participants from the US Consulate, the UICC, and our masterclass was in radiation oncology and digital health. Next slide. A few months ago, we were at an event, a tech event at Yaba, and we moved to University of Lagos, and we had the opportunity to pitch one of our startups, Onkopadi, to the VC, and he was very excited about digital health. And some of the things we discussed have now transferred to the HOD for us to pursue those conversations. Next slide. A few weeks ago, we were at Atombaneko Digital Research Center. I was there as one of the panelists with the BOI chairman. And there I made a case for the Digital Health Hub that we would like the BOI to sponsor the 3rd innovation hub in Unilag, because they have sponsored 2 in Unilag. And we would like them to sponsor the 3rd one. And again, we're in conversations with them. And I've also briefed the provost, the HOD, and hopefully this will materialize next year. A situation where our hub is expanded from a room to a building. Next slide. Today we're going to have speakers who will talk about the work they've done in digital health and panelists who will share their ideas on how we can advance digital health in Nigeria. Next slide. And so our call to action is if you have any ideas or you just want to understand digital health, come into our enabling space. We want to build your ideas. We want to transfer our knowledge. We want our frameworks to you. And we want your ideas to become companies like Enzo, companies like SimLab, Cleaner Lancet, hospitals like Luth. It always starts with an idea. But we are the hub that will sit with you to ensure that you bring those ideas to life, especially if you see there's promise in it, it is profitable, and it will solve some of our healthcare problems in Nigeria. And we do this through twice a week. We have what we call digital health clinics. We block out about 2 hours where different people, different experts will sit with you and your ideas. We provide mentors. Like if you need mentoring in AI, we'll find an AI expert to work with you very closely. We do trainings and workshops like this, and we create networking sessions. Next slide. Thank you very much.
Round of applause. Thank you very much, Dr. Ololasa, for that address, for that exposition on the RDRR Digital Health Hub. And I can foresee a wave of growing or of new digital health startups in Nigeria, because this hub that we are launching today is obviously not just a space. It's an inspiration, it's a place to incubate ideas. Too many times the medical students forget that our lecturers and professors that are making waves today were once students like them. So the vision that the hub is bringing forward is actually quite a profound one, in that they are guiding students, providing mentorship, providing assistance in order to lead us towards taking our ideas and innovations into actual products that for sustainable development. So thank you very much. Please, a round of applause for our next item on the agenda. I'll be calling up our mother, a person who has made many things very possible for both the Association of Medical Students as well as other student associations in the college, to give us the keynote speech. Yes, in the person of she will be giving us the keynote address to the dean of the Faculty of Clinical Sciences, Professor Folashade Adejola.
This young man is going places. I met 2 of them at a medical association meeting. There were 2, one man, one woman, and they were compared. And I looked at them and said, "Do you miss your way to medical meeting?" Because they answered the event so well. Of course, she called me Mama. Immediately I came in, we started to see progress here. Students, gave me so much trouble. This one. Now the protocol, the Vice Chancellor of the University of Lagos, Professor Oluwatoyin Odipe, the 12, the tribe, and the disciples. And the Jesus one, represented by my darling sister from the source, Professor Mokimola Odushaku. You are welcome to the College of Medicine. You are very loving and we are very accommodating. The provost of the College of Medicine, my brother, who is unavoidably absent, Professor Adewale Antonio Oke. They ably represented by another friend and brother, Professor Taiwo Eboyi. Taiwo is relevant to me because I'm like I don't want to say, but I follow the trend. I'm the fifth in line with the trend from my mother's children. So you see why I always want to call Taiwo. So I'm number 5. So my brother, Dr. Adeyomi, Associate Professor. 3R, not just one. You are very powerful. And thank you for the past 10 years, you remember. It is well. Yes, and now, another mentee here. The head department of radiotherapy. I feel I've never been a patient in the now I talk to this guy. Professor Abayomi Okola, the former deputy provost, who's been a family friend since about 4 decades. And children go together. So, before I met you, we know where this speak. As a medical student, anywhere I see him, oh no, what are you doing here? Every corner, he was there. And he was always talking politics. Right or wrong? Yes. We are here today and I'm really delighted. And I'm happy. The Lord will continue to honor you and to honor your health. And you will live long in the mighty name of Jesus. Sorry, I'm not a pastor, but I need to encourage you. Now I come to the person that brought us here today. My mentee, the one that I'm delighted on, that I'm always proud to see, Omolola Sala. You have just started because we pray that our children will be higher than us, and you are going to be higher. I'm really delighted about what you're doing today. I'm proud of you. And I'm proud of 4 other people in my faculty. My faculty is delighted. The only thing that I would say next time, just for note, I'm an event organizer. We're not supposed to be in this room. We're supposed to be in the room. So many people. We are doing the first thing in hospital in Nigeria, probably in West Africa, and we're here. Next time, consult so that dollars will roll into my pocket. Thank you for bringing us together. Thank you for planning. That's it. No, I'm coming to that. You know, I'm supposed to give this talk, so I'm coming to that. You know where I went. And I'm delighted because you're not the only person that is doing this in my faculty. I have 3 of them. You know the amount of money. They kept telling me, not matter. That is not her money. The research money. She had to account for every dime. In the college that was giving my talk. Yes. What's my percentage in my faculty? Yes. Was come to me. It's not word of mouth. I want to kill it. It is my percentage of grant money in my faculty. Not faculty. So you are looking at my eyes. And so that is my collaboration. Dr. Ayebusi, who is currently in Spain now, and Dr. Piri. Those are the 4 that are making way. That actually, during my tenure, I'm just dancing. The more will come. I'm waiting for you, Dr. Lowe, I'm waiting for you, Dr. Alabi, I'm waiting for you, Bukola, I'm waiting for you. Everyone must be on their feet to bring grants to my faculty. You know, university, they do not. I come out right. No. Don't give us the time in the faculty. We are just by name. Right or wrong? Yes, answer now. You are entitled to, you cannot deny. Yes, so I need to get money from my faculty. And this is the percentage from grant. Yeah. You are there. Really happy. And you know when you are there, my sister said my name. We always like that. It doesn't bear that. But it's empty. Time with devotion. So now to business. My darling Omolola, I'm really happy. Because when you look at the meaning of hope, it's a center. A very well functional center. And that's what we're going to represent. Both the college, the youth, and the university. And that is why I'm coming down to collaboration. We are in this room. Please let me see for that department. Talk for your hand. Maybe they are online, but they must be here. They must hear the story. They must hear him so that we all move together. So that's what assignment. There are about 4 hours inter collaboration. It must start. What benefits? The next one I have, this must be repeated and long. Look for long provision. You must bring it back. Everybody must hear. Wow, this is new. You know, you mentioned all the generations. You didn't mention my name. I'm not the baby woman. I came before the baby woman. It still says that the baby woman. Am I right? Yes, I was. I'm not a baby woman. I'm not a baby woman. Mama. Mama, baby woman, next generation, and their generation. Those who are now 9 months are using computer for the home, holding it 20 So everybody will come together to learn. No, I'm also learning. God makes you your own. And I said, this is like God for Nigeria. I was really like power. So this thing was not given. It must be shown to everybody. We must have e-art to showcase ourselves. All the universities, whoever wants to collaborate with us, they're welcome. We're looking for $1 billion support, right, so that we can also be in that area. So we have just started. We work at just started. Open up your game. I am alone. Very powerful, very impressive. Don't leave me behind. And then I go on bring in our students, medical students, nursing students, life science students, all the students here in the College of Medicine. The university collaboration with they're supposed to be there, but I saw it, but I believe you may be online. We need to collaborate. And then showcase College of Medicine, the University of Medicine. We are serious. Yes. Very good. And then, before I sit down, I want to talk about eyes. Close your eyes, everybody, and move out of this room. Close your eyes and move out. So that's why she has to collaborate. The next one we're going to hear is about how to find solutions to life. We have some particular conditions that lead to blindness. So how do we do that? We are going to do that together with my partner. And then I'll see. Well done. Take your time. I thank you all for listening.
Calling up our next set of speakers, and they will be covering advancing mobile health research. And the first speaker, who is going to be giving his speech online, is on the Zoom platform at the moment. He is the director of the Entrepreneurship and Skills Development Center, University of Lagos. He's a professor of business administration with special interest in strategic management and research, as well as competitive and comparative strategy, amongst others. He's in the person of Professor Sunday at the ABC. Please a round of applause for him as he addresses us on advancing mobile health research. Welcome, sir. It's good to have you here with us.
Thank you very much. I want to thank everyone that is there. I don't wish to establish any other protocol, so let me start on the one that have been established when they started. And I say thank you. I could see the senior management of this university are there, and that gladdens my heart. And I say thank you very much to Provost, to the Dean, my wonderful, amazing mother friend. So thank you very much for building the youth. Thank you very much, ma. Unfortunately, so sorry, I'm speaking to you from our hotel room. It's Dr. Salako that could do this. I'm burying my mother this weekend, so I just had to just rescue myself from the graveyard to come and sit in the hotel to talk about this, because this is extremely important to me, especially when I see this giants right from the College of Medicine. I've been one of the great advocates of College of Medicine because there are a lot that can come from you, especially in the dispensation of the fourth industrial revolution. And let me start by saying that Africa and Nigeria have not fared very well in the first, second, and third industrial revolution. We lost it so well that we are almost operating at the first industrial revolution, which the world will not wait for us. So when you see amazing innovation that is coming from the kind of the hub that we're talking about today, there is nothing we need to do than to support this kind of a thing. And I listened to Dr. Salako, and I know something was missing. She did not mention to you the kind of amazing support she'll be getting from our center. I know that was an oversight. We've deployed everything behind to ensure that our business model is right, and to ensure the fact that this is going to be number one in Nigeria, because we have a business up to date that has been created in the entire nation, the first to be in any Nigerian university, and we are leading other universities today to be able to do that. Even Ife or Ibadan or Benin, 100, not less than 100 universities have visited us for us to support them on how to do this. And what is the meaning of this? The meaning of that is that we want to ensure that the university system is not just a house where theories are theorized, but we want to convert it to a house and an ecosystem where theory meets with practice, and businesses, spin-off and startup can come out of our university system. University of Lagos has started doing that, and we've been carrying alongside College of Medicine, and thanks to one of your students that is there that participated in BITE. I will tell you, amazingly, I saw a lot of College of Medicine students who will never look for a job, who will never run abroad, but are going to leverage digital into bankable businesses in Nigeria, and I'm happy with that. So back to why we are here, I want to let us know something today, that digital health is the way to go. I celebrate the Dr. Salako's team for doing this, and I want to quickly say this without missing my words. Now that I found the leaders of College of Medicine listening to me, that if we do not want our public health sector to become another post office, there is not adding value today. When internet came, you have to follow through with what we're talking about now. Otherwise, I'm sorry to say, LUT, LASUT, or UNAMI, the one in UNN, if it will become a post office in the future. You know what is happening today? Nobody goes to post office now to post letters. All of us are glued to our heyday. When it started, post office thought that, no, nothing can take us away from here. You could see what is happening today, that so many of them have become monuments in various cities that are not useful. Because digital health will take access, easily, make it to be easily accessible at the comfort of every human being, like the GSM in your hands. And I need not to come to your hospital. All I need to do is I'm able to go on my mobile, speak with my doctor at the comfort of my house, and he consult for me, she consult for me, and she leads me to the pharmaceutical whatever that will bring my drug for me. If I need to go through surgery, and all those things are pre-planned, everything is planned, and I go into my surgery room, maybe ambulance comes to pick me up the day I am going. Everything has been synchronized like Uber. I am picked, from my room. I go into my surgery room. You are done with your surgery. There will be another set of people that will be playing in the valuation of recovery, taking patients that will recover, they house them, they do everything for them. That is what digital health will offer in the next 10 years. If you're a practitioner and you're not thinking entrepreneurship alongside your alongside your health practices, at the end of the day, I pray that we do not become more and more like post office, in the next 10 years. I am particular about this because this is the kind of research we've been doing. We spoke about this about 10, 15 years ago. They never listened, and you could see what that has done. Regeneration, reconfiguration of post office then, you see, nobody cares about it, and you could see what it is today. So, Edge 2, yes, we may think that, yes, especially the tertiary health facilities are so few in Nigeria. There will still always be the pressure that people will queue, that the service will be poor. I tell you, by the time we're able to create as many startups as possible, like what Dr. Salako's team is leading today, health becomes easily accessible. And people have choices. I have a choice in between Airtel, in between Globacom, in between MTN today, and I can easily select which one I want to use as I move on. And at the end of the day, by the time we're able to create as many startups as possible in the various fields of medicine, and it becomes, bankable, commercially viable, and it is, and people can earn income from it, I tell you, so many of our big facilities may become more remote. So what am I saying? I am saying that since I found the leaders of LUT there, that this is what needs to be embraced holistically, the entirety of LUT system and College of Medicine should begin to look at how digital health can be infused into health practices in all the facets of discipline, multidisciplinary aspect of medicine in our university. I can speak to you today that we're leading in the entirety of the nation in terms of, co-working incubation hub that looks after all disciplines. Like I used to tell us, all disciplines have been converted to entrepreneurship at University of Lagos. What Dr. Talako is pushing there is what we call entrepreneurship. And whatever your discipline is, you must understand the entrepreneurship side of it, and that is then it is possible for it to be sustainable. I want us to understand that digital innovation aids have been designed to help to save time. You see, it helps to save time, it will boost accuracy and efficiency. It's going to combine technology in a way that that are new to healthcare system. And the innovation can make medicine to be seamless and make medicine to be enjoyable and make both the patient and the practitioners to be happy. I don't want to come to LUT and wait eternity. You people will come to LUT today, they will come by 5 a.m. just because we have few, urologists. They come by 5 a.m. They won't leave there by 3 a.m. by 3 p.m. At times, they don't even get to see consultant. That what we are doing is a inimical to ourselves. I know for sure that it's a pressure to on even the health practitioners who will sit down all along without even being able to track how many people he wants to see per day, how he will be able to divide his time to sit them, to see them or those he will sit with. And all of these things, are not made possible today because we have not embraced digital health. Once we do so, I know by 11:15, I'm seeing my consultant. Once I on my television, my system like this, my consultant is speaking with me. It does his 10 or 15 minutes. It's referring me to where it needs to refer me to. I'm booking on my system, and the pharmaceutical whatever outlet that will be talking to me is dispensing my drug. And before I say Jack Robinson, my drug is delivered to my doorstep. And when my drug is delivered to my doorstep, maybe there's an app I can go into to look at how I'm able to take my drug. And I'm even saying that there may be app that I will subscribe to that will be reminding me when it is 3 o'clock I need to take my drug, when it is 7 p.m. I need to take my drug, and it's telling me, look, it made life so easy, so simple for all of us. It's simple for you guys that you're there, it's simple for me, your patient. And that is what we have to deliver. And if there's any university that can deliver it, it is not any other university than University of Lagos. We have to think entrepreneurship in everything we do. We have to think about creating value in everything we do. And we can make it to be so seamless and so enjoyable, even that pains becomes enjoyment. I'm very, very particular in what I'm saying. That at a point in time, you see, you get to see your patient easily. The mobile technology is deployed, and I can speak to my consultant. I can chat with my consultant, and at the end of the day, I know for sure that artificial intelligence and robotic engineering will equally even support us, where it is possible that we can create the robot that will be able to chat with me, that will be able to take me to a level, maybe save like 75% of the time of the consultant. And it is at least at the robot analytics will be able to create a whole lot of analytics that at the end of the day my consultant can work with, and he will only use 25% of his time to solve my problem because the robot has been able to take me through within 75%. I'm expecting the Dr. Salako team to begin to look towards this direction. So my message to all of us today that this is the way to go. And I will close by saying, if we don't want our big, hospital, tertiary hospital to become another post office, every unit of the hospital must embrace, digital health. All the practitioners must embrace digital health. It is important. It is the way to go. In the next 10 years, that is what will drive the health ecosystem. And may I tell us, for some of young people that are here, look, running to abroad is not an option. Do you know why? Any company in the world that is not in Africa by 2030 does not have a future. Most of the people that run away will be running back to Africa and be looking for opportunity in Africa by 2030. It is simple because this is where the opportunity is. And this is where we still have so many problems that are convertible to bankable businesses and opportunities. And it will shock us, the kind of giants right in the next 2 years, that this hub, the hub in College of Medicine will be able to deliver, because I know the potential is huge. Can we all come together and align our thought together and begin to take business and begin to think at business in a way and manner that comfortability will be brought to the patient. The practitioner themselves will be able to be to work in dignity, because they will leverage, mobile health technology, the digital health technology, to ensure the fact that they give good access to health to the patient, and they themselves too will be able at least to smile to banks. That is always very important to me as an entrepreneur. So I want to thank you very much, and to say to all of you that all the support you need, or the business model, Dr. Salako will tell you, we deployed everything that we need to deploy to support him. I have not given, since I've been away to bury my mom, I've not attended to anything like this. The moment she spoke to me yesterday, I told her I am going to be part of this, because I give that priority to College of Medicine to let you know that we celebrate you, and any innovation that comes out of College of Medicine, we're going to stand with it. So it is on that note, I appeal to Provost, to the leadership of College of Medicine, to understand that this is the future of the College of Medicine. This is the future of LUT. This is the future of health in Nigeria, and entrepreneurship is the way to go. And once we all key into this, I know for sure we're going to sing a new song. So thank you very much for having me and for listening to me. I say congratulations to everyone in College of Medicine. Thank you very much.
I'd like to call Dr. Omola to quickly say a few words.
Thank you very much, Professor Sunday Adebisi. I must correct my mistake. For the past 6 months, almost every month, I'm present at the BOI Innovation Center that Dr. Adebisi leads, the Entrepreneurship Skills and Development Center. And I want to thank you, sir, because today is also possible because you've been very supportive of me. I'm grateful for your mentorship. The BOI Innovation Center is also an enabling space. It's very beautiful. When you go in there, starting from the colors, the psychology, it's beautiful. And from time to time, we go into that hub in Unilag for a few things. One, to rub minds with Professor Adebisi. Two, to actually begin our grant application. Our last few months, we were trying to apply for a grant, and we were about 10 that went to the hub. And Professor Adebisi sat with us, went through the application for about 2 to 3 hours. I want to thank you very much, sir, for everything you have done for me, professionally. Thank you very much for the sacrifice of today. I'm grateful. Thank you for releasing some of your scholars to support our research team, like Dr. Bukola. Thank you very much, sir. We'll be coming back for more support, and thank you so much. The business model is one area we're going to begin active working, because we've been trying to set up. Now that we've set up, we also want to get our own startup model correctly. Yeah. And we'll chase you very hotly for that.
Yeah, you're welcome. Yeah.
Thank you, sir.
Thank you very much.
And we have Dr. Matthew also, who is a researcher at the University of Leeds, West Yorkshire, England, with a focus on the delivery of cancer and palliative care. Welcome. You have a call.
So hi everyone, I'm Matthew Alsop. I'm a University Academic Fellow at the University of Leeds, and thank you very much for the opportunity to present today as part of this exciting initiative. And it's wonderful to see such commitment and enthusiasm for digital health. And I just wanted to provide a short presentation on 2 aspects that have been really critical to work in digital health to date, both context and collaboration. And these have been key across many projects, including those which I've been fortunate enough to undertake in partnership with colleagues at the University of Lagos that have included both Dr. Salako and Dr. Okunade. And we know from working with colleagues at the University of Lagos that they're very strong in both context and collaboration, and it'll be great to see both embedded strongly in the practices of the new Digital Health Hub. So digital technologies are complex interventions, have many elements. Development has to be dynamic, it has to be iterative, creative, and open to change. And there are many actions to consider, from both the planning of an intervention and its development through to its design and further refining. But critical components to intervention development are understanding needs of stakeholders, understanding the clinical problem to be addressed by a technology, the specific role that technology might play to improve it, and the expected changes in outcomes that you might be able to measure. And a great example of efforts to understand the needs of end users was a large multi-country study we recently completed in partnership with the University of Lagos. And we explored the potential of digital technology for patients, caregivers, health professionals and policymakers in cancer care. And the study was conducted across Nigeria, Uganda and Zimbabwe. And we now have a really clear list of ways that we can target improvements in palliative cancer care by developing and testing digital health interventions. And in terms of the team, we've found critical to the digital technology development process. It's included multiple crucial elements, but we always start with the experts, the patient and their family, or the intended users. So this could also be other groups such as health workers, clinicians, or policymakers. But the intended users of an intervention are the experts of their condition or the problem you might be targeting. So they need to be involved right from the start and throughout the development process. Before you begin developing an intervention, you can form groups of patients and caregivers for whom you might be considering developing an intervention, and explore their experiences and the acceptability of emerging design ideas, alongside exploring what barriers might be experienced. And there's so much scope for innovation around user involvement for technology design in Nigeria. Then you need the wider team, those who are going to develop and build, and each component is of equal importance. So clinicians have such a crucial role in helping to frame the clinical problem, provide insight into how technologies might be embedded into clinical practice, and how any data or information from digital technologies can be used to inform patient care or the management of patients. You then need the technology developers who create the technical solution, and they need to make sure it aligns with or builds on or improves existing information systems. And then the researchers, and I'm biased as a researcher, but they're critical to this process to gather the requirements and the needs of intended users, to develop the theoretical basis of interventions, such as behavior change theory, and evaluate how technologies influence the outcomes that they're actually targeting, and whether those outcomes are improved, whether they don't change, or whether in fact they could be worsened. I think with technologies, research has such an important part to play in understanding unintended consequences from the use of digital technologies as much as it does about improvements that can be realised. There's also lots of new study designs evolving for digital health technology design and evaluation. Sometimes a randomised control trial is ideal, but there are also lots of exciting new research approaches too that we can explore through the hub, including, for example, the multi-phase optimization strategy as an example. So together, this combined team can help to work towards optimal digital health solutions and determine how future iterations of effective digital health interventions might be further refined, adapted, and scaled up. And the last critical element is the evidence base, so avoiding duplication of work that's already been done and building on what already exists in the research literature. So I think systematic reviews are your friends, and also making sure that there are approaches developed to remain informed about emerging research literature on digital health. And just to provide an example of how I've worked from understanding the context and users to inform the development of digital health interventions. At the University of Leeds a few years ago, we developed an online system to support pain self-management in patients with advanced cancer. And we know that patients engaging with palliative care experience multiple physical symptoms, which can affect their quality of life and psychological well-being. And pain in particular, alongside symptoms such as fatigue and shortness of breath, are highly prevalent. So up to 64% of patients with advanced cancer report pain. And in terms of pain, there are known barriers to good pain management reported across the literature. And these include things like knowledge deficits, so how and when to take medication, also inadequate pain assessments, so assessments are not performed routinely or systematically. And then there are a lot of misconceptions regarding pain. So for example, fear of opioid addiction. So we developed a digital health intervention to support communication between patients and health professionals with the aim of supporting education and self-management information, which also included non-pharmacological approaches, also routine and timely reporting and sharing of pain reports from patients to health professionals, and then also symptom management support. And ensuring the launch of new digital health innovations are rooted in user needs will increase the likelihood of impact and their usability. So I've mentioned the value we found in understanding the context and the users in which a digital health system is being developed, but there's also the need for collaboration across the multiple elements of that necessary team. And we've developed approaches previously to support shared language. So the image shown reflects a software development approach that might be familiar to some people, called Disciplined Agile Delivery, or the DAD methodology. And this is a formal structure used to guide health information technology development from initiation of ideas through to implementation and then eventual retirement. And you can see key processes running through the middle are inception, construction, and transition. And for the pain self-management intervention we developed, we've modelled our research data collection around this known and familiar method to the software development company. So we identified critical points for information sharing that could inform the system development and refinement, and plotted the two methodologies together. So the software development process is running through the middle, providing multiple points for findings from our surrounding applied health research to inform iterations of the system and its development. And through those points of inception, construction, and transition. And the surrounding green and orange show the research methods we use. So for example, in green, you can see a diary study, an interview study, and face-to-face interviews that we conducted with patients at the start, and then also health professional engagement at the bottom. So if we're to develop innovative technologies, we need to make sure we can all communicate and work together well, creating a shared language across clinicians, researchers, and technology developers. So there's a lot of scope for innovation in digital technologies, developed at the University of Lagos with potential for widespread and global impact. And the Digital Health Hub has the skills and expertise to really understand the needs of intended users of digital health interventions. And there's plenty of opportunity to develop new and innovative ways of working with and involving patients, caregivers, or others for whom a technology is being developed. So I look forward to continuing to develop approaches to user involvement and collaborative working through the partnership between the Universities of Lagos and Leeds, and continue to enjoy our great and enjoyable work together. The University of Leeds are privileged to have been able to partner with the University of Lagos today, and we look forward to seeing this great initiative thrive and lead digital health of the future. Many thanks.
Thank you very much. We have Dr. Kende Ikwadi, who is a consultant, obstetrician, and gynecologist of the College of Medicine, University of Lagos, also joining us from the Zoom platform. Welcome, sir. It's good to have you here with us.
Yeah, good afternoon, everybody. Yeah, good afternoon to my teachers, the Provost of the College of Medicine, University of Lagos, ably represented by the Deputy Provost, Professor Iboyi, a wonderful teacher. My academic mother, Professor Akishola, the Dean of the Faculty of Clinical Science, College of Medicine, University of Lagos. Well done, ma. And other very important personality that I briefly cited. My friend, Dr. Olojabutu, yeah, the chairman of the Unilag Lagos branch alumni, well done. And the host of today, Dr. Salako, is giving me great pleasure to just give very brief presentation of a collaborative effort in terms of research in the mobile health technology intervention. So, yeah, I will briefly talk about what exactly does mobile health is. And in simple terms, we call it M-Health. In some other parlance, we call it e-health. So by definition, when we talk about mobile health, it means that you are adopting the application of the application of mobile devices for medical and public health practice or intervention. And when you use the mobile devices to intervene in medical and public health practice, you tend to, the implication of that is that give you the opportunity to reach out to a whole lot of people, and it also reduce the strain on the healthcare system. There are many devices that are already categorized as mobile devices that can be used for public health intervention, starting from cell phone or smartphone, tablets. We also talk about the use of some laptop, smartwatches. We also have e-readers and so on and so forth. So technology has really gone a long way in changing the landscape of how healthcare delivery intervention is delivered to our doorstep. Next slide, please. So why are we talking about mobile health? Mobile health has given us the opportunity to be able to carry out health promotion, prevention, treatment, rehabilitation, and palliative care. And I'm going to just during the course of this very brief presentation, give us an insight into how we've been able to, in collaboration with Dr. Salako and my friend from University of Leeds, Matthew, who has been a great collaborator in terms of, research in the digital health space. So why are we using mHealth in healthcare intervention and research? Because if you look at what from a previous research that we have done in 2017, which we published in 2018, we can see that there is an exponential increase in the use of mobile telephone, especially in households, because as it is now in Lagos State, up to about 95% of household, we have at least one person owning a mobile device. So, and that gives an opportunity for us to be able to, spread the healthcare intervention to a whole lot of household. Then, of course, mobile health strategies, as it is now, currently exists in up to 75% of countries in the WHO region. And this is a clue from the WHO report of 2011. So, next slide. The use of mHealth in health service delivery can actually be in manifold. It's been found that mHealth can be used to link patients and care providers. It can also help in empowering patients to control their health, because if the healthcare instruction treatment is delivered to your mobile phone, it allows you to be able to decide and to be able to use the information that is provided for you to determine how you want to approach your own health. And of course, you can get a linkage to your healthcare provider. That gives you the opportunity to also be able to determine how you want your healthcare delivery to go. From some panels have also described that mobile health can also help to improve the cost effectiveness of healthcare delivery, because you will not have to have a whole lot of patients, congregating within the healthcare space, so that our facilities and our doctors, our nurses are not overworked because of a whole lot of patients, coming to the hospital or coming to the health facility. And of course, this gives an opportunity for the healthcare system to also be strengthened. Then, of course, this is debatable because you can look at it from both sides of a coin, that it reduces inequality. It reduces inequality in the sense that some people that cannot come to health facility can also access, healthcare delivery, because information about their health and can be delivered to their doorstep, and you can consult with your healthcare provider on mobile phone, especially if you don't have the means to transport yourself to a healthcare facility to conduct face-to-face with your healthcare provider. Now, what about mHealth application? mHealth application is very useful in clinical research, and I'm going to give you a few examples of how it is applicable in clinical research. So we can use it for data collection. You can use it to ensure enrollment and retention of patients in research. It's also very useful in medical education and training, and of course, it's also very, very useful in healthcare intervention. Whether you want to talk about care retention, it's been used in HIV care retention, TB care retention, treatment and care delivery, treatment reminder, especially for patients that needs to be on lifelong treatment that needs to be taken every day, especially for patients that are on TB treatment, antiretroviral therapy for HIV, patients that are diabetic, they need to be reminded every day that they need to take their drug. Of course, treatment adherence monitoring. If you look at the directory of observed therapy for TB, and of course, that may be a very useful tool. Screening, follow-up, and adherence, especially for those of us in oncology, and of course, also for side effect reporting, especially in the area of oncology, like patients that are on chemotherapeutic agent, they can directly report their side effect symptoms directly to their oncologists, even when they are at home. And this is actually the basis for the current research that is being conducted by Dr. Salako and co. So this is an example of a publication that we did, especially in the health landscape. This particular one is, you can see how we can use the mobile health technology to develop the mobile health intervention through research. And this is a publication that was done about 2 years ago. Can you go to the next slide? So also we've also used the opportunity of mobile health and even the digital space to also collect data. This study that was done last year during the COVID-19, the peak of the COVID-19 pandemic, and you can see an example of how we were able to reach out to healthcare professionals to be able to get their view on how they feel that the telemedicine can be used, especially when it comes to within the digital space. Next slide, please. Then, of course, this is another example of how we can use the digital space to also ensure medical education and data collection. This particular study, in collaboration with one of our colleagues in the University of Nigeria, Nsukka, and of course also by Matthew Osop, was done to actually evaluate the usefulness of an electronic platform, which students on how this you can use the platform to deliver education. So in this particular instance, we use the platform to deliver pain management education to medical students in College of Medicine, University of Lagos. And you can see that from the outcome of the study, we were able to collect very, very interesting data. And of course, we're also able to use to further develop the platform that we use in delivering the research technology. Can you go on, please? So we've also used, we've also assessed the acceptability and potential effectiveness of a part of EL tools among the healthcare workers. And we've also used it to deliver healthcare training, especially for healthcare workers in very remote part of Nigeria. This particular intervention was introduced somewhere in Ondo State and some part of Abuja and Kano State. And you can see that even within some very, very, very rural settings, you can introduce the use of mobile and EL technology, and this can help to deliver training to healthcare workers that are within those settings, so that they can deliver the best of care to their patient. Next slide. So also we've also used mobile technology intervention for screening and support to provide support services. This is a publication that came out in 2017, in which we look at the uptake of cervical cancer control services at the Cancer Information Service Center in Lagos. This was done at Shebekli Cancer Center, and you can see all the very instructive information that we're able to get, and you can see the most important reason why patients actually call, using the platform to assess screening and support services. Next, of course, we've also examined the use of a cancer information system using the mobile technology intervention to look at how treatment navigation can go. And this is actually a study that was done to actually give women with breast cancer the opportunity, the opportunity to be able to navigate services with regards to knowing where to go for mammogram and also to do breast scan in Lagos. And of course, for those that have breast cancer, the opportunity for them to also be able to navigate treatment services within Lagos and other parts of the country. Next slide. So we've also use the digital technology to extend maternal and child health services to rural settings in the country, and it just a spillover for the initial study that I talked about that was conducted in Ondo State and Abuja and Kano in Nigeria, which we did in collaboration with some of our colleagues in the University of Leeds. Next, also, this is a recent publication by Okunade, which we used the mobile technology intervention to assess cervical cancer screening adherence among women that come to the general outpatient clinic of Lagos University Hospital. And it's actually conducted as a case control study. And you can see that the use of mobile technology in the form of periodic short message services reminder actually increased the uptake of pap smear screening among women that were enrolled into this particular study. So it was a very interesting finding. Can you go on, please? So, in a nutshell, it's very important for us to know that with the introduction of mobile health technology intervention, did give an opportunity for us to provide linkage between patients and the care providers. And of course, it also decreased the cost of healthcare delivery, because you wouldn't have to, you wouldn't have to have to overwork the healthcare workers, and there will not be any need for you to, all the consumables, the hardware that you need to, to make healthcare provision for patients may not necessarily be required. And of course, it's also applicable in research, like I mentioned, in education, and of course in healthcare delivery. But it's very important for when I talk about inequalities in the sense that is it useful in reducing inequality? Yeah, on one hand, it is very useful in reducing inequality because it makes provision for you to be able to access healthcare intervention without having to come to the hospital. So, but the pitfall of this is that you must have a mobile phone for you to be able to access healthcare using the mHealth technology. What of those that do not have mobile phone? So on one hand, it can help to reduce inequality. On the other hand, there may be the pitfall of also contributing, it may be in a very small extent to increasing inequality, because it means that those that do not have mobile phone will not have access to healthcare intervention. What about the issue of ethics? What about the issue of confidentiality? What about the issue of airtime? Because you need to have your phone loaded. You also need to have a very good internet connectivity, which is still a very big problem in low and middle income countries. Yeah, next slide, please. So, thank you very much for the opportunity, and so I'll wait for any question if you have any. Thank you.
Thank you very much. That was our very own Dr. Kende. Before we move on to the final session, I'd like us to recognize the presence of Dr. Nicholas Karabi, the former head of department of radiation biology, radiotherapy, and radiography. We also be recognizing the presence of Professor M.A. Awada, the former president of the Nigerian Association of Medical Physicists, and the former coordinator of the Medical Physics Wings of the College of Medicine, University of Lagos. And now we'll be moving on to our panel session, and we have our panelists with us here today. We have Dr. Solomon, the lecturer at the College of Medicine, University of Lagos. We have Dr. Akana Ramadu, the Chief Operating Officer at Overcooked Hardy Technologies Limited. We have Dr. Ali Itoni, a medical physicist at the College of Medicine, University of Lagos. We have Dr. Samuel Ekundayo, a Digital Health and Cancer Research Fellow at the Overcooked Hardy Technologies Limited. And we have Toby Adiem, a medical student at the College of Medicine, University of Lagos. Now, so briefly, in 1 minute, I want each of our panelists to introduce themselves and talk to us about how to implement digital health, the steps in advancing digital health, in their own field or career.
Good afternoon, everyone. I would like to start an existing protocol. I am Dr. Adora Momodu A. I'm the Chief Operations Officer and co-founder at Untitled Technology Limited. I'd like to say Untitled Technology Limited is a digital health innovation company, and we have a mission to empower confident healthcare decisions by patients. We've been in existence in 2017, and we've developed solutions like our Untitled mobile and web app, which has services like telemedicine, our health shop, and our online community that has supported over 1,000 cancer patients. We also have products like the Untitled app and our clinical care study app, which we are doing in partnership with the University of Lagos. Untitled is a company that has been last year. We are so proud of it because we are supported by most players in the state. We've had partnerships with companies like Microsoft. We've had partnerships with companies like MTN. We've had partnerships with companies like US Astella Oncology, and where we are grand prize winners of the US Astella CP Prize for 2020. Now, I would like to just share 6 lessons we've learned on while building some of our solutions. So the first thing I'll say is, I would like to say is to focus firstly on revenue from day one. Now, revenue is key whether you like it or not, and every other metric that you have is vanity. Every team member, from the design team, to the CEO, to the management team, or even to the digital marketer, everyone needs to be a part of the revenue generation model. And just as Prophet said earlier, we all have to sit back to rethink our business model. All startups are made to generate revenue. They are made to generate revenue. And so it's very important that we rethink our business model towards revenue generation. Now, because Nigerians are very, very lazy, it's very important that we remember to always keep it simple. Keep it simple. So when we deploy products, when using products or technology solutions in the market, please always remember to keep it simple. Lastly, I'd like to say, because the generation we are, technology is always evolving. It's always important to mix it up, whereby Prof has already said that the post offices back then used to exist, but now we no longer have that. We have simple solutions like our Facebook messengers, we have other messaging solutions, right? That we have emails and so many other solutions. So it's always important that as the technology evolves, companies and researchers, scientists, innovators are also evolving with those technologies. Thank you.
Thank you very much for this opportunity. Solomon Wandering, the lecturer in the Department of Biomedical Engineering of the University of Lagos. My contribution to digital health, specifically in the areas of digital health education and research, as well as several other contributions. First, I teach courses related to digital health in the department, health informatics, and ICT, technical ICT, and courses I teach. I also teach studies in neural networks. So, one of my major contributions, which she has mentioned, and the previous also alluded to it in the speech, is this book, Information and Communication Technology in Healthcare. It was launched on the 2nd of September this year. So this book was written as a result of non-availability of text within this space within our society, within our system. So I wrote it in collaboration with a friend at the PhD lecturer at the University of Southampton, United Kingdom, where I was the first there. So the book contains basic information everyone needs to be able to understand ICT, and then we talk about the various aspects of digital health, including health and health, telemedicine, information system security, and so many other aspects. Beyond the book, I also made several contributions in my research. Also, 2 weeks ago, we recently launched the non-invasive telemedicine center at the Department of Medical Microbiology. I'm a co-investigator with Dr. Rita Oladide with the PI. So we work together to put up in place funded by FINA. It's a telemedicine center that will support those having challenges with fungal infections. I also make the conditions for research in the area of food registered patents. One as a PI, the second as a collaborator. One is with the first one is on development of smart infant apnea monitor. It's an IoT-based device developed to monitor apnea in 10 infants who also have hypertension. The second one is the university project led by Professor Henry and with that, it's on the 10th paper project or public contribution to the Sabiano testing stage now. Also, I also make several other contributions within this space of primarily in the area of machine learning, using machine learning for diagnosis. Recently, one of our research papers was published at the Health Informatics Research Journal, which focuses on the application of machine learning algorithms for the prediction of diabetes. I published it with Dr. in the Department of Public Health and other collaborators in that team. So, also last year, we had a competition, the Youth Innovators Competition organized by UNESCO, UNECA, and UNECA. It was a virtual competition. I mentored a team that worked on Trace Africa. It's a software for contact tracing of COVID-19 patients. So that team has metamorphosed into a small startup, which is working behind the curve to launch the application. Thank you very much.
My name is Dr. Ibitoye from the Department of Art. So I have worked with the use of microwave ablation, and then in that sense, I was able to develop another device for ablating for behind the tumor in the breast and other part of the tissue. The work was being helped by my people knowledge of the computer tech. But without having digital knowledge, it wouldn't have been possible. So if we are to achieve anything, we must have that basic knowledge of the computer. We must be ready to have a knowledge of how to simulate because the world now is moving on a new technology. And then how to know that technology cannot be achieved without having basic knowledge. So with that one, I was able to design such a device. I was with the collaboration of other people, Professor Ogudola and Professor Ontutoki, and then we are still working on it to make sure that we don't into the market. So all this were achieved with based on the collaboration and the medical was really another department, and we were able to work together. So computer knowledge must be there, and there I really thank God for this for the help in our department. I know it will go a very long way in assisting somebody like us in the other field of the medical business. That we will use it and then maximize and then gain a lot by launch our service to it and then take out a new device that can be used
cancer and treatment and for diagnosis. It will be of a great help and so thank you very much. And Dr. Ekundayo Samuel started cancer research program of Ubali Technology Limited, and by way of further introduction, the current Secretary of Congress Scholars at Federal Government of Nigeria, and last year I was selected as one of the most party global to actually from across Australia, but largest science site in the world, and I'm the only one, as a category, still the only one in Nigeria. So, what I do in Uganda, I lead the big target, research portfolio, and one thing that we just try to observe, try to hypothesize and think of ideas, do research about those ideas, and also try to publish, also form ideas, money making ventures, like what we are seeing today, trying to launch a hub. Just from my own little research experience, at the moment, I think one of the ways to actually advance the digital health research is actually one of what we're doing now. The first thing that we start with awareness. So people need to know about digital health. Because it's not only the ethical solution that goes to people who are patients and also potential patients. Because one way or the other, one or the other might actually cost their own time. So it's good that we actually get to know about it. And also, like what we're doing now at the moment, the research that we're actually carrying out, we're looking at the input from patients and also the medical professionals. Their input in building a tool that will help to track and monitor their health. So we need to get everybody involved in it. So one of the ways to actually improve the actually get everybody involved. So and everybody needs to understand that we need to get beyond the planning in the implementation and also think also about the evaluation. Well, I also advocate because it's actually an academic development that we should also internalize digital ethics of our curriculum in the system. So it is good that we have digital also as part of our course because since we are actually projecting the next 10 to 10 years, everybody will actually be thinking about digital health. So I think it's good that we also incorporate digital also into the curriculum of the universities. And also I will also say that we need to also do because we're working on data, working on development, we need to strengthen our collaboration with the communication and network companies. So that because people can, who are actually at the ground, they can actually access that. Because most people in some local areas, they are still on 3G. So for people in Lagos, we have 4. So I think we need to improve on that. And also we need to strengthen the legal and the ethical aspects. Because it is actually with a lot of legal issues about this, how to connect data actually out of data. I think with all this, I think if we put them in place, we need to improve actually advance digital health. Thank you so much.
I'm an existing professor. My name is Toby Adeyemi, and I'm a founder of the College of Medicine, University of Lagos. So, as question, advancing medical health in my field, my field is that medical student. So, I'll be talking as a medical student. From the next step to what we are starting today will be the engagement of the student in. So, taking it from here will be the student engaging what we are starting with digital health of building ideas and then increasing ideas and going out to build startups from there. From what I wanted to say, just like to be awareness. When you talk about awareness in patient perspective, so I'm talking about awareness in student perspective. We need more programs like this where we get to hear about the importance of digital health. We need our lecturers, we need our consultants, our theoretical residents to talk more about digital health, the importance and how it can be incorporated into what we are doing, even from our everyday clinical rotations, our everyday lectures right now. From right now. And another thing I would like to talk about will be from awareness, we begin to accept that as reality. Digital health now has been so pandemic was an opportunity to the engagement of digital health, and it only goes up from there. So it's important that, like you said, we now involve in inculcating into our curriculum, where we've got to understand that digital health is digital, we've got to understand the importance of digital health. But now we want to know more about digital health and how we can go about step by step operating into every problem we see and building solutions from there. The final thing I'm talking about will be engagement, which is something that I believe everybody does a lot. There are a lot of students who send to the Kobadi. As we intern and Kobadi, we get to experience and see some of the things. So we get to engage with these things, we get to engage with some of the things that they are building, some of the things that they are ideating, and we begin to think outside the box as well. We begin to believe that we also can start things like this, we also can work on things like this, and I believe that it only goes up from there.
Thank you very much. Let us to use the opportunity to update our panelists. That brings us to the end of the panel session. Let's appreciate them for giving us their views on advancing digital healthcare. Okay, so with this, we will be moving on to the IBRR Digital Health Hub for the official launch of the center.
So, I want to say special thank you to everyone who have been able to make it down in spite of your tight schedule, and much more that we're able to wait till the end of the program. I mean, this is quite wonderful. Please give everyone a round of applause. You agree with me that from all the speakers and all the remarks made, that this digital hall is first of its kind in this country. And it is only meant for our BRR department, but it's meant for other departments because we are open to collaboration from other departments and other faculties, and for the whole of University of Lagos. I was when Professor Kofana heard about this, did you invite the Dean of Basic Sciences? Did you invite the dentist? I said, yeah, they're going to invite all of them. But unfortunately, maybe because of time, we couldn't make it down here. They were all invited. Isn't that so? So I want to say that I wish our president could be saying this. Why I'm saying this is that now we are using a 21st century solution to solve a 21st century problem. The country is using 19th century solution to solve a 21st century problem. It cannot work. It cannot work. So we are trailblazers. So I wish the president